today's video we're going to be talking about the four muscles in the thigh, the quadriceps, Q for quads. If we look at the quadriceps muscles, there are four muscles that make up the group of the quads. First, we have the rectus femoris muscle, which is the one in the middle, right here on top. We also have the vastus medialis, which is in the middle, underneath the rectus femoris, as well as the vastus lateralis, which is on the outside, underneath the rectus femoris. And then if we peel the rectus femoris away, we get the vastus intermedius, which is between the vastus medialis and the vastus lateralis. So all four of these muscles together are the quadriceps. Three of them attach to the top of the femur, and the rectus femoris itself actually attaches to the pelvis up here. Looking at quad injuries, we can see a couple different things that can happen due to pain within the quadriceps. We can have a muscle strain, which is just a micro tear within the muscle itself that can be due to an overuse or a sudden blow to the muscle. We can have tendonitis within the quadriceps tendon itself, which is down here that attaches to the kneecap. So all four of those quadricep muscles form into the one tendon that attach to the kneecap itself. So if there's an overuse injury, inflammation within the tendon itself, micro tears within the tendon, it can cause a tendonitis within the quadriceps tendon. We can also have an avulsion, whether it's an avulsion of the tendon itself, so a rupture of this tendon, as well as an avulsion fracture here in the hip, where this rectus femoris muscle comes and attaches to the front of the hip. So if there's a lot of force that's pulling, it can cause this avulsion fracture. If the growth plate's not closed, it can happen a little bit more frequently, but it can also happen in people that have a closed growth plate that are a little bit older. Some of the common treatments that we'll do for someone that comes in with the quadriceps muscle are muscle therapy, so active releases, trigger point therapy, instrument-assisted soft tissue therapy. We can do kinesiotaping to the area. A common one that we'll utilize for any type of muscle injury is the laser itself, so the class 4 therapeutic laser that's going to help with speeding up the healing process, increasing blood flow to the area, decreasing the amount of inflammation and pain in the area. Another thing that we'll look at is to see if there's any adjusting that we need to be doing, whether it's from a compensation due to the injury or if there's just restriction in any of the joints. The adjustments can be done within the knee, the hip, as well as in the pelvis and low back.